Hello, welcome to Wellbeing. I'm Guy Murphy. Today my guests are Dr. Wendy Lee, Associate Professor of Psychology at James Cook University, and Dr. Marc Chao, Lecturer and Researcher in Psychology, also from James Cook University, and today we'll be talking about mindfulness. Thank you for joining me on the show today, Marc and Wendy. So, to start us off, your work shows mindfulness can reduce PTSD, depression, and anxiety symptoms. What are the key mechanisms driving these changes? Dr. Lee, would you like to start us off with this one?
Hi, yes. I think changing the relationship between the mind and the body is one of the important mechanisms because our mind does not connect to our body very often, even though mind and body are all together. And when mind is always naughty, bring our body all the time. For example, if you have the experience of a sleepless night, a so sleepless night, and then the mind always blame the body. Why can't you go to sleep? Actually, it's the mind's problem, but because the mind is racing very fast. So changing the relationship between the mind and the body can change the perception of some of the symptoms. For example, I had a participant who is a veteran, had some physical injury and experienced lots of pains. And before he joined the mindfulness intervention, he blamed the body and very frustrated, mad at himself because he could not do some easy movements because of the injury. But after practicing mindfulness, and because mindfulness always brings the mind back to the body, and he found that actually the pain helping to bring the mind back to the body. So he called the pain as a good pain. So you can see the change from being mad of the pain to appreciate the pain as a good pain. So this is the one of the mechanisms. And from this, we develop a stop strategy, STOP, S for slowing down, P for take a breath. When we slow down, take a breath, and then observe. O for observe the body, body sensation, the thoughts, the feelings as well. After we slow down, take a breath, and observe, we often found new options. Then we can proceed with new options. So that's the STOP strategy. And with the strategy, participants often develop skills to regulate their emotions. This is important because for people, for example, anxiety or PTSD or anger management, emotional regulation is very important for them to reduce the symptoms.
Fantastic. So it's about... you mentioned that this man had PTSD, was that correct?
Yes.
And so once he had practiced mindfulness, he found it easier physically to move.
Not to move. The relationship between the pain and the mind changed. And for example, in the past, he perceived the pain is a very negative thing. So he was mad at the pain he was experiencing. But now he regarded the pain as a good pain because the pain helped him to bring the mind back to the body.
Right, okay, interesting. And Dr. Chao?
Yeah, so I totally agree with Wendy's examples here. At a fundamental level, what I feel that mindfulness helps people respond to stress differently or pain differently. So what we see in our study and in the broader research is that instead of reacting automatically, which is what often happens in PTSD or anxiety, mindfulness gives people a bit of space to pause, notice what's going on, respond more calmly. So for many veterans, there is always this strong culture of just pushing through, get on with it, don't show weakness, deal with it yourself. So that works in the military. But when it comes to mental health, it can mean people bottle things up or react quickly without realizing it. So what mindfulness does, one of the mechanisms is to gently interrupt that pattern. It helps people to slow things down so that they are not reacting immediately to the trigger or getting pulled into those cycles of negative thoughts or difficult memories. It also helps people to stay more present in the moment. And instead of the mind constantly going back to past experiences, they are better able to ground themselves in what's happening right now. And another really important aspect is self-compassion. So veterans can be quite hard on themselves, feeling that they should be coping better or handling things on their own. So mindfulness helps to shift that so they can respond to themselves with a bit more compassion, a bit more understanding rather than judgment.
Interesting. And moving on, in your studies, symptom improvement sometimes persists even after the intervention ends. What helps maintain those long-term benefits? Dr. Lee?
Practicing mindfulness. For example, during the intervention, participants practice mindfulness meditation in class, and we often have two formal mindfulness practice in each class. And then we give them the recording so that they can practice at home. And then after the intervention, they keep practicing. Just like Professor Kabat-Zinn, the developer of mindfulness-based stress reduction, he suggested that we can regard mindfulness as a muscle. How can we make our muscle stronger? Keep practicing. For example, practicing half an hour a day or 15 minutes a day rather than practicing 24 hours just for a day. Keep practicing, consistently practicing will make the muscle of mindfulness much, much stronger as time goes by. But also we see in our follow-up, some of the improvement disappeared. And because we have the follow-up, we ask participants what they did after the intervention. Then many of them reported, I don't have time to practice, lots of commitments, family, kids, and work. So some of them stopped practicing. And that's why in the follow-up, we often see the effect, the improvement, start become weaker and weaker. So practice is the key.
And Dr. Chao, do you have anything to add to that one?
Yep. One of the really encouraging things we found in the study is that the benefits don't just disappear once the program ends. So in our study, we did see a slight return of the symptoms over time, which is quite normal, but overall participants were still doing much better than where they started. So a big reason for that is that, as what Wendy mentioned, mindfulness isn't something that you finish. It's a skill that you carry with you. So for veterans in particular, many start using these skills in everyday situations, whether it's, for example, managing stress at home or dealing with sleep or even handling triggers as they come up. It becomes something they're more used to it. It's something more practical, not just something you do in the session. And there's also a shift in how people relate to their thoughts and emotions. So it's not just about feeling better in the moment. It's also about responding differently when things get tough. I think the group side of things also plays a big role. A lot of veterans really value that sense of camaraderie, and going through the program together builds that connection and accountability, which can also assist with making the effect last beyond the session. With that, as what Wendy mentioned, there is a slight return of symptoms we observe, and that tells us that ongoing support is important. So things like refresher sessions or community-based groups can really help people maintain those gains over the longer term. For example, we run monthly Mindful Warrior sessions here in Townsville at JCU Central Plaza. These are 1.5-hour sessions held on the second Saturday of each month, and they are open to everyone, not just to veterans. So it's really about giving people a space to continue practicing mindfulness and as well staying connected.
That's fantastic. That's really nice that you specifically run a mindfulness program at the university.
Yep. So Prof. Wendy is the mindfulness-based practitioner, and she facilitates these sessions every month. So everyone's welcome to join.
And have you observed any unexpected or counterintuitive outcomes from mindfulness interventions, Dr. Lee?
That's a very good question. We were interested in whether there were some adverse effect of practicing mindfulness. So we asked participants during the inquiry time whether they experienced some adverse effect or adversity during the practice or when they're practicing at home. No participants reported any adversity after practicing mindfulness, but there are some very touching and unexpected stories from our participants. For example, I had the participant who's a victim of violence against women. When she first came into the class, I can see the anxiety, the nervousness in her body language, as well as facial expression, and also lots of negative self-talk during the inquiry. For example, when she could not do something, or she did not experience other participants experienced what other participants experienced, she always blame herself. Oh, maybe I'm not good enough. Maybe I am not smart. So you can see lots of negative self-talk. But I think that's in week 6 or week 7. In her sharing, she told a very touching story. She had a therapeutic horse that's prescribed by her psychiatrist. So before practicing mindfulness with us, the horse can sense her anxiety. So when she came close to the horse was anxious. For example, kicking the front leg, and after, because she went to see the horse every day, and after practice 6 weeks or 7 weeks, I don't remember exact week, and she found the horse settled down with her because she's calmer, and the horse could feel she's calmer. So the horse, she called it, is a horse purring like this. Like this. So it's very interesting. Even the animal, the therapeutic animal, can feel the change of the participant. So it's a very lovely story. But there is another unexpected story. It's about the options, because in the mindfulness practice, we provide a lot of options to participants. For example, in one of the instructions is about the anchor. For example, we use our body part, for example, our breath, as an anchor to bring the mind back. It's just like the anchor of a boat parking in a river, a lake, or harbor. So for me, providing options, a river, a lake, or a harbor, makes sense for me. But one of the participants, who's veteran, told me, "Hey, Wendy, can you please don't provide any option to me? Just let me know whether it's a river or a lake or a harbor. Not give me the options. I just can't make the choice." This reflected their training in military. Only have one option, one direction, no other options at all. So they started to learn to make the decision among different options, but they found it was difficult. So this is quite an unexpected outcome, but it's a very interesting story.
And Dr. Chao, would you like to add anything more?
Maybe one counterintuitive outcome from this study was, although we saw very clear reduction in PTSD, depression, and anxiety symptoms, we didn't really see a significant increase in self-reported mindfulness. So in other words, people were feeling better, but they weren't necessarily saying, I feel more mindful. So what that suggests is that the benefits of mindfulness might not always come from people consciously noticing that they're becoming more mindful. It may be happening more in how they are responding to stress and emotions rather than how they describe themselves. So another important point is that mindfulness isn't always isn't always immediately effective or relaxing, especially at the beginning. For some people, especially for those who have experienced trauma, becoming more aware of the thoughts and feelings can actually feel a bit uncomfortable at first. So it's not about switching off or feeling calm right away. It's more about learning how to sit with those experiences in a different way over time.
You're listening to Wellbeing. My guests today are Dr. Wendy Lee and Dr. Marc Chao, researchers in psychology at James Cook University. Your review highlights the importance of culturally adapting mindfulness for First Nations communities. What are the biggest challenges in doing this effectively? Dr. Lee?
For me, I think the most important thing is for First Nation peoples, the connection with the land and also the ancestor and kinship. This is not something in the standardized mindfulness-based stress reduction or mindfulness-based cognitive therapy. And because for mindfulness nowadays, from a scientific perspective, it's quite westernized. So the connection, we all know land is the root of First Nation peoples, but it's not something that is included in the standardized mindfulness-based program. So I think this is very challenging when we work with First Nation people.
And Dr. Chao?
I think one of the biggest challenges is that we are not just adapting to one context, we are working with two. So on one hand, we have the military culture, which really values things like discipline, structure, or self-reliance. And on the other hand, First Nations veterans, there is a strong emphasis on community, spirituality, and connection to land. So the challenge is really making sure that the program speaks to both of these worlds at the same time. And as what Wendy mentioned, if mindfulness is delivered in a very Western, individual-focused way, there is a real risk it doesn't resonate. So for many First Nations peoples, healing isn't just about the individual, it's about connection to family, community, culture, and country. And if those elements are missing, then the engagement may drop off. And what we want to highlight in our review is that cultural adaptation goes beyond just translating a program. It involves using appropriate language, incorporating cultural metaphors, and aligning with community values and ways of understanding well-being. And importantly, making sure that the program, the broader context people are living in. And that's very much consistent with how we approach our work with veterans as well. Even though the model came later, the underlying principles are similar. We are making sure that the intervention is not just clinically sound, but also culturally and contextually meaningful. So in the review, we highlighted approaches such as co-design as being an important element, particularly when working with First Nations communities. In our veteran study, even though we didn't use a formal co-design process, we did take a trauma-informed approach, focusing on things like safety, choice, and respect for participants' experiences, to make sure that the program felt appropriate and supportive.
I like your answer. It actually brings us into our next question quite nicely, which is, do you think westernized mindfulness sometimes loses important elements from its original traditions? Dr. Lee?
Let's look at the history of the development of mindfulness-based program. And when Kabat-Zinn brought mindfulness-based stress reduction from Buddhism perspective. And there were, in 1979, there were lots of elements from Buddhism philosophy. But he found that not many people come into the program because of the religious philosophies. So he started to remove the Buddhism Buddhist perspectives, and keep it as a secular program, and in a quite clinical way, becoming a standardized program. But we can see the change in the past couple of decades, particularly in the past 2 decades, that more and more cultural perspective elements are included in the mindfulness-based programs, so that it reflects the cultural roots of people or participants. For example, particularly for First Nation peoples, the connection with the land, country, and also ancestor community. And so there are lots of mindfulness-based program, adding the cultural indigenous elements into the program, into the standard program. So I think that the original traditions are not completely lost, but instead we bring it back in a stronger way. For example, in the mindfulness training, we have the Buddha, the perspective from Buddha, and also lots of Buddhist elements to learn, to discuss as well.
Fantastic. And Dr. Chao?
Yep, completely agree there. It's less about saying that Western mindfulness has lost something. It's more about how it's been adapted over time. So in modern settings in Sabat Zen, mindfulness is often delivered in a very secular, clinical way. In that process, some of the cultural, relational, and spiritual elements can be reduced or left out. So that's partly what makes it accessible, but it can also make it feel a bit disconnected for some groups. So for First Nations veterans in particular, that's really important. Healing isn't just about the individual, it's about the connection to community, culture, and country. So if mindfulness is presented as something that's very individual focused, it may not fully resonate with their lived experiences. So a one-size-fits-all approach can sometimes feel a bit removed, and that can affect engagement, and people might not see themselves in the program. So I don't think the goal is to move away from Western mindfulness entirely, but rather to build on it and to reintegrate cultural meaning, community, and context, so that it's accessible to both. It's both accessible, genuinely relevant to the people it's designed for.
And in your work with veterans, how does mindfulness compare to more traditional therapies like CBT or medication? Dr. Lee?
That's a very good question. For the participants, for example, we run two programs, one for a veteran, one for veterans, one for victims of violence against women. The participants have been through so many therapies, such as CBT and other prolonged intervention for PTSD as well. So they have been through so many therapies. And they found, some of them, for example, some participants told me that when they joined in, because the therapist recommend the program to them, they thought, oh, maybe that's another shit program. But actually, after they joined the program, they found some differences between mindfulness-based intervention and CBT. For example, in CBT, they were asked to record what happened, which means they need to record the traumas they have experienced again and again to different therapists. And then the therapist identified their problems. This is your problems, 1, 2, 3, 4, 5, 6. And this is what we are going to do, 1, 2, 3, 4, 5, 6. And at the end of the sessions, we are going to achieve 1, 2, 3, 4, 5, 6. So it's very structured. And the most important thing is for this therapist, they identified that the client has problems. But in our mindfulness-based intervention, we did not set any goals for participants. So some of them, because they got used to the structure of CBT, they were kind of lost, asking me, "Hey, Wendy, can you tell me what I'm going to achieve after this session?" And I told them, just follow your body. Your body will tell you what's going to achieve. In the first 3 sessions, they feel confused. But it's very amazing. From week 4 to week 5, they started to feel, okay, I know what it means. Listen to the body. And so this is one thing. We don't set any goals. Just ask our participants to listen to the body, to focus on the body sensations, to acknowledge the thoughts, but we are not modifying your thoughts. We are not modifying your behavior. This is the big difference between mindfulness intervention and CBT. CBT tried to modify the behavior. And also, we are not sitting there to teach participants what to do. I practice every meditation practice with them. So they quite appreciate that because they feel that I am part of them. I'm part of the group. I am one of them. I am not sitting there to teach them what to do, but to listen. They do need people to listen to them. I'm not analyze what's wrong with them. I just listen to their stories and reframe their questions so that they start to think about the questions themselves to seek for the answers. And also, of course, we don't use any medication. But some of the participants, for example, they use body scan before they go to sleep or mindful breathing. And one participant told me that he stopped using sleeping pills after practicing mindfulness a couple of weeks. So this is quite amazing and we can see the difference between the mindfulness-based intervention and CBT and medication.
And Dr. Chao?
Yep, I would agree that mindfulness fits really well alongside the more traditional approaches rather than replacing them. There's growing research showing that mindfulness-based programs can be comparable to therapies like CBT, and in some cases even to medications like antidepressants. So it's definitely a legitimate evidence-based option. For veterans, one of the big advantages is that it is non-pharmacological, so there are definitely fewer concerns around side effects. It's also more acceptable for people who might be hesitant about medications or more intensive therapies. Another important point is that mindfulness doesn't require people to directly revisit traumatic memories. So for some veterans, that can feel quite confronting, and it's one of the reasons why we see higher dropout rates in some trauma-focused therapies. So mindfulness offers a different pathway. It helps people build skills to manage their responses without having to go straight into those experiences. So really, I think the best way to think about it is that mindfulness complements existing treatments. It gives veterans another option, and in many cases, it can be used alongside therapies like CBT or medication as part of a broader, more flexible approach to mental health care.
Interesting. And coming back to the veterans, are there specific types of mindfulness practices that work better for trauma-exposed groups? Dr. Lee?
It's hard to say which type of mindfulness practices are the best. I think all mindfulness practices are helpful, and the key is that which one is the best for the individual. And often people would find which one is the best for them, and after the practice, there are different type of meditation. For example, we start the program with eating meditation because we eat every day, but very often we eat very fast. So we slow down the process, bringing attention to the flavor, the taste, the shape of the food, so that people slow down the process. And also with body scan, it's not putting under a CT machine, but it's use the mind to scan the body bit by bit. And also we have attention focus practice and use the anchor to bring the mind back to the body, and have movement, meditation, for example, lying down and standing yoga. And because with movement, it's easier to slow down the mind, to bring the mind back to the body. And we have walking meditation as well, because we walk every day, but we often park our car and walk very fast. But we slow down the process, paying attention to the muscles involved in the movement, and also have sit meditation with more silence. So every practice have its advantages and have its limitation. So it's up to the individual to choose which one's the best. So that's why we provide lots of options for them. And regarding the trauma-informed practice, it's more about that when we deliver the program, we provide options to the participants. We respect them, we listen to them, and we don't teach them to do anything. We listen to them, we practice with them together. And we did not ask them to record any traumatic events in the past. And also, we are sensible for their emotions. For example, sometimes when they share, they may cry, and we are sensible to what's going on. And also, sometimes there's something occurring that is unexpected. For example, there was one participant in my women group. I think the day before the class, she had a very bad experience with one of her family members. She was bullied by the family member. And so when she came in, she was upset and she did not share anything. So I did not bring my attention to her so that she feel more comfortable. And then we did the walking meditation. She could not walk. She's standing there, could not walk at all. So I observed that, and then I asked her, do you mind to hold my hand to walk together with me? And then she said, oh, yes. So I hold her hand. I can feel that her hand were very cold. And then we walked slowly. So she started to walk. And another participant next to her also gave her hand to the participant. So we, two of us, hold her hands to walk together. After 1 and 2 rounds of walking, she could return to the normal walking. So this is something that when we work with trauma-exposed groups, being flexible, being caring, and it's very important.
And Dr. Chao, do you have anything to add to that?
Yep, completely agree with Professor Wendy there. When it comes to trauma-informed version of mindfulness, it's really important to emphasize things like safety, choice, and giving participants a sense of control. That's especially important for veterans because many have experienced situations where they've had very little control, so we don't want the intervention to feel overwhelming. In terms of practices, things like breath awareness and grounding exercises tend to be really helpful because they help people stay connected to the present moment. And body-based practices like the body scan can also be useful, but often with some flexibility depending on what individuals are comfortable with. So one important thing is that for mindfulness isn't about pushing people to go inward too quickly or too intensely. For some people, especially earlier on, that can be quite challenging. So we take a more gradual approach. And as what Professor Wendy mentioned earlier, flexibility is really, really important. It's not about forcing people to do every practice the same way. We encourage participants to listen to their own bodies. If something doesn't feel right, they can adjust or step back. And that sense of choice is really important, especially for trauma-exposed groups.
You're listening to Wellbeing. My guests today are Dr. Wendy Lee and Dr. Marc Chao, researchers in psychology at James Cook University. And moving on, mindfulness is sometimes viewed as a universal solution. What are its limitations or cases where it may not work well? Dr. Lee?
And absolutely, I don't agree that mindfulness is a universal solution. And sometimes for some people, mindfulness just doesn't work. And for example, we often have an orientation session before the 8-week program and give some little bit taste of mindfulness for participants, and so that they can feel whether this is something for them. But we sometimes have some dropout after the first orientation session. Some participants just told me, hey, Wendy, this is not my thing. This is not my cup of tea. So it's not a universal solution. And also, it, just like I mentioned previously, practice is the key. So people need to practice, need to have some time to practice, and also need to be patient. Because, as I said, if we regard mindfulness as a muscle, it takes time to build up the strength of the muscle. It's the same for mindfulness. So people need to be patient, to practice, and also trust themselves. Because very often after one or two sessions, we can't see the outcome, then we don't trust ourselves, we don't trust the program. So practice being patient and trust is important. And it will work very well if we have patience on ourselves and we trust ourselves, and also we keep practicing. That's the key.
What are the personality and psychological factors, if any, that contribute to to mindfulness being ineffective for some people?
I don't have any study looking at the personality and mindfulness, but I think absolutely there are some connections between personality and mindfulness. But more importantly, I think, for example, mindfulness, during if we are experiencing high level of stress at that moment or during the period, mindfulness often doesn't work. For example, even for myself, I formally practiced mindfulness for more than 5 years, and also including some informal practice for more than 10 years. But for me, if the level of stress is very high, and for 2 or 3 days, I could not practice mindfulness at all. The mind just keep racing, just keep running away. So this is the limitation for mindfulness. But what we are doing is that if we practice every day, then the thresholds would be higher. So we would deal with stress better than without practicing mindfulness. But still keep in mind, when the stress level is very high, it's difficult to practice mindfulness. But when it settles down, for example, for myself, if the stress level is high, I could not practice mindfulness quietly. I often listen to my own recording. The recording guides me through the process. That after 2 or 3 days, the emotions settle down, the mind settle down, then I can return to the normal practice.
And Dr. Chao? That's an interesting follow-up question in terms of one of the barriers to practicing mindfulness. I think one of the barriers, at least those that I've spoken to, is skepticism. So for some, mindfulness can be perceived as a bit abstract or even soft, especially compared to the more traditional or medical approaches. So people might question whether it's really evidence-based or practical. And that's common in groups where there's a strong emphasis on being results-driven or action-oriented. If something doesn't immediately look like it has clear, tangible outcomes, it can be, a little bit harder to buy into. There's also misconceptions like thinking that mindfulness is about clearing your mind or just relaxing, which can make it seem a little bit less relevant or even unrealistic. So often I think it's not resistance to the idea of improving mental health, but more about how mindfulness is perceived, understood, and presented. So once people see it as a practical skill rather than something abstract, and that skepticism often will probably start to shift. So yeah.
Is there a risk of over-medicalizing mindfulness when used in clinical settings? Dr. Lee?
Yes, absolutely. In the clinical settings, originally, actually, mindfulness-based intervention developed for cancer patients to help them to manage the pain. And when it comes to the clinical settings, actually for now, lots of training emphasize that mindfulness-based intervention is not a clinical intervention. It's more about preventive intervention rather than treatment. So if the over-medicalizing mindfulness, there is a risk. And it's just like coming back to the metaphor of muscle. And if we overtraining our muscle, overusing our muscle in the gym, then our muscle will be hurt as well. So it's the same. If we over meditation, and I think the body will be hurt as well. So it's important to be mindful that when we practice mindfulness, listen to the body. The body will guide us whether it's overdose overall, it's helping to minimize the stress. Listen to our body.
And Dr. Chao?
Yep, I think there is definitely a risk of over-medicalizing mindfulness, especially when it's treated purely as a clinical tool. Mindfulness originally came from much broader traditions of cultural, philosophical, and relational aspects. So when it's reduced down to just a technique to manage symptoms, I think there is a risk that some of that nuance and depth might get lost. At the same time, however, the clinical side is also really important. It's what allows mindfulness to be researched properly, evaluated, and integrated into healthcare systems so that people, including veterans, can access it in a structured and supported way. So I think it's really about balance. We don't want to strip mindfulness down so much that it loses its meaning, but we also want to make sure it's evidence-based and accessible. So it's about bringing those two together, combining the science with lived experience so that mindfulness is both effective and meaningful for the people using.
And has your own understanding or practice of mindfulness changed through your research, Dr. Lee?
Yes, absolutely. And also through my teaching of mindfulness. For example, before I formally practiced mindfulness-based stress reduction, and for example, I listen to some of the podcasts and reading some of the online information about mindfulness. So always I thought that empty the mind is important for practicing mindfulness. But after I practicing mindfulness-based intervention as well as through my research, my understanding of mindfulness completely changed. I understand it's not about empty the mind, suppress the thoughts. It's more about acknowledging what is going on at the present moment. For example, I give a metaphor, butterfly, to my participants. We saw a butterfly, there's a bad butterfly flying in front of us to somewhere. And we are not killing the butterfly. If the butterfly just like, oh my, they're racing to somewhere, we are not going to kill the butterfly, but we acknowledge the butterfly's there, but we are still grounded. We are not following the butterfly. We bring ourselves back and we are grounded. So this is something that changed my practice and my understanding of mindfulness. Is not about eliminate the unwanted thoughts, but it's more about to acknowledge it, but return to the present moment. What is the present moment? The body, the breath.
Interesting. And Dr. Chao?
One thing that's really shifted my own understanding is meeting people who practice mindfulness regularly, seeing how they approach stress, how they respond to challenges, and some of the inspiring stories of how they how they relate to themselves made me realize it's not about being calm all the time or doing the practice perfectly. It's influenced how I approach it myself as well. So earlier on, I was more focused on the techniques, whether I was doing it properly or trying to feel a certain way. But over time, I've become less focused on getting it right and more focused on just noticing what's happening in the moment and responding a bit more thoughtfully. So it's become something much more practical and everyday for me, not just something you sit down and do for a few minutes. It shows up in how I deal with stress and how I deal with difficult situations and even how I relate to myself when things don't go as planned. So yeah, I think it's been very beneficial for me as well.
That's lovely. And what unanswered questions in mindfulness research are you most interested in tackling next, Dr. Lee?
We are interested in a couple of things. And for example, the personality thing you mentioned previously, I'm quite interested because I'm teaching personality psychology. I'm quite interested the effect of personality on mindfulness. And also, we just received a grant from a community grant in the U.S., and we will conduct mindfulness intervention for older people in Australia and in China. So it's a cross-cultural comparison. We would like to see whether mindfulness practice can improve sense of control for older people, because when we are aging, we kind of feel we lost control of our body because our body's functioning is declining, our muscles not as strong as previously as we were young, and also lots of things happening. So we would like to see whether mindfulness-based intervention would improve sense of control of their life for older people, and also if there are cultural differences between Australian participants and Chinese participants.
Sounds fascinating. Perhaps once you've looked into the effects of personality on mindfulness, we could catch up again and revisit the topic.
I'd love to do it.
Fantastic. And Dr. Chao?
Yep. So me and Professor Wendy are working on a few other directions as well. So one area is developing mindfulness-based approaches for climate-related anxiety, also known as eco-anxiety. So we're starting to see this more and more, particularly in the rural and regional communities in Australia, where people are directly experiencing things like floods, droughts, and extreme weather. So the focus there is on how we can support people's mental health in the context of those ongoing environmental stresses. Another area we're exploring is also the link between stress and physical health, including conditions like diabetes. So we know that chronic stress plays a role in these conditions, so we're looking at whether mindfulness can help at a physiological level as well. For example, we'll be measuring cortisol, which is a stress hormone, including through hair samples, which gives us an indication of long-term stress rather than just what's happening on a single day.
And just to wrap us up as well, what's one misconception about mindfulness that you wish more people understood? Dr. Lee?
When I run the mindfulness intervention, people call me asking me, the potential participants call me asking me, are we going to sit in a dark room for quietly for a long time? So this is a misconception. And no, not at all. We have lots of techniques to help us to bring our mind back to the present moment. And for example, one of my participants told me that she tried mindfulness herself a couple of times but failed because she could not sit quietly for a long time. But after she joined the program, she found, it's much easier because we have different techniques. We are not sitting in a dark room quietly for a long time.
Interesting. And Dr. Chao?
I think one of the biggest misconceptions about mindfulness is just about relaxing or clearing your mind. It's not really switching off your thoughts. It's becoming more aware of them and changing how you respond to them. It's also not a quick fix, right? It's also not passive. It actually takes practice, like what Professor Wendy says. You are training up your mindfulness muscle. You're training your attention, a bit like a mental skill, so that when stress or difficult emotions come up, you can therefore handle them differently. So rather than getting caught up in your thoughts, mindfulness helps you step back and relate to them in a more balanced way.
Great. Well, thank you very much for sharing that with us. And that'll do us for the show today. But thank you very much to both of you for coming on the show today.
Thank you so much. Let's get in touch.
Absolutely.
Thank you.
Not a problem at all. My guests today were Dr. Wendy Lee and Dr. Marc Chao. Thank you again for joining us on the show. Thank you for listening. I'm Guy Murphy, and all of us at Wellbeing wish you well.